Hello everyone. My name is Dr. Muskaan Chabhra and I'm working as consultant IVF at Birla Fertility IVF, Lajpat Nagar. I welcome you to this session regarding precautions and procedures of ovum pickup. What is the procedure of ovum pickup? Ovum pickup procedure is a part of the usual fertility treatments that we do and is an essential part of the IVF process. Ovum pickup का मतलब है कि जो eggs ovaries में form होते हैं, we retrieve those eggs under anesthesia and these eggs are taken inside the lab and along with the husband sample, ICSI or conventional IVF is done and babies are formed. अब ओवम पिकअप प्रोसेस क्या प्रोसीजर क्या होता है एंड हाउ डू वी गो अबाउट इट? द प्रोसेस स्टार्ट्स ऑन डे 2 ऑफ योर साइकिल. Once we do a baseline scan on the day 2 of your cycle and if that scan is okay, we start you on some injections. The purpose of giving these injections is that multiple follicles should grow inside your ovaries. Usually in a natural cycle, a single egg is formed inside the ovary and this egg matures and ruptures around the time of your mid-cycle. But in the process of IVF, we give you multiple injections and the process, the use of these injections is that multiple eggs should grow at the same time in a single cycle in the woman. Usually these injections are very painless. Usually 1 or 2 injections are given per day. And after 10 to 12 days of these injections, when our eggs or our follicles are big enough, trigger injection is given. The purpose of the trigger injection is to mature the eggs that are forming inside the follicles. Once the trigger injection is given, आफ्टर दैट 36 आवर्स के बाद हम लोग oocyte retrieval या फिर ओवम पिकअप का प्रोसेस करते हैं. इस ओवम पिकअप के प्रोसेस के दौरान आपको फास्टिंग आना पड़ता है प्रोसेस के लिए, मतलब आप ओवरनाइट फास्टिंग रहते हैं. मॉर्निंग में यू रिपोर्ट टू द सेंटर इन द मॉर्निंग एंड एट द टाइम ऑफ द रिट्रीवल वी गिव यू अ शॉर्ट general anesthesia which lasts around 15 to 20 minutes and we insert a probe of the ultrasound machine along with the biopsy guide inside the vagina and with the help of a very thin needle we go inside the ovaries, puncture these follicles and retrieve the follicular fluid. This fluid contains eggs. This is sent into the lab for processing and inside the lab these eggs are screened and separated. This procedure is extremely painless, requires only 15 to 20 minutes of the time and patients are usually discharged on the very same day after a few hours of monitoring. And what are the precautions that you need to take during your ओवम पिकअप प्रोसीजर? तो हमें क्या क्या चीज़ें हैं जिनका ध्यान रखना है जिससे ओवम पिकअप का जो हमारा प्रोसीजर है वो विदाउट अ हिच हो जाए और उसका रिजल्ट अच्छा आए, और उसके दौरान और उसके बाद हमें क्या क्या सावधानियां बरतनी है, दिस वी हैव टू डिस्कस. बेसिकली ड्यूरिंग द ओवम पिकअप प्रोसीजर्स इट इज़ वेरी इंपॉर्टेंट कि पिकअप और स्टिमुलेशन से पहले आप अपने सारे ब्लड टेस्ट जो आपके डॉक्टर ने बोले हैं वो करवाएं. एक बेसलाइन स्क्रीनिंग फर्टिलिटी की होनी चाहिए एंड योर बॉडी शुड बी ऑप्टिमाइज्ड बिफोर वी स्टार्ट द प्रोसेस ऑफ स्टिमुलेशन. स्टिमुलेशन के प्रोसेस के दौरान अपने सारे इंजेक्शंस एज पर योर डॉक्टर्स एडवाइस टाइमली लीजिए, अपनी सारी मेडिकेशंस आप टाइमली लीजिए and make sure that during the process of stimulation you stay very well hydrated, you drink a lot of water, take a lot of fiber and have very good high protein rich diet. ओवम पिकअप के प्रोसीजर के दिन पर से बी स्ट्रेस फ्री, Do not take any undue stress and come fasting for the procedure. And post procedure, make sure that you take a soft diet, do not lift any heavy weights, and do not keep any sexual intercourse with your partner. If the ovum pickup procedure is done correctly and properly, usually recovery is very fast, and within the next 1 or 2 days you will feel like your usual self. कोई problem as such दिक्कत आप लोगों को नहीं होगी, because the safety profile of this procedure is very high and the procedure is very extremely safe. आज की डेट में a lot of couples are going for IVF, a lot of single women are going for egg preservation and egg pickup, and oocyte retrieval is a very safe process in which you can go ahead and do this very safely. Thank you so much for a patient hearing. If you have any questions, you can comment in the comment section below, or you can reach us at Birla Fertility and IVF. Thank you.